Hello and welcome to my channel. This is the first lecture in the upper limb, and today we will be talking about the osteology of the shoulder region. So let's begin. The shoulder is where the upper limb attached to the trunk. The bones of the shoulder are the clavicle. The clavicle, the one you see here, this is the superior surface of, this is the right clavicle, by the way, superior surface and inferior surface. It's the only bony attachment between the trunk and the upper limb through the sternoclavicular joint. This is the only bony attachment of the upper limb to the trunk. S-shaped, as you can see here. Medially it's convex forwards and laterally it's concave forwards or convex backwards. The sternal end is rounded and the acromial end is flat. Okay. Now on the inferior surface, you can see on the medial side here the impression for the attachment of the costoclavicular ligament and the groove for the subclavius muscle, the one you see here. And here you can see two marks. This is the trapezoid line and this is the conoid tubercle. These are parts of the coracoclavicular ligaments. It's composed of the trapezoid ligament and the conoid ligament. So these are the marks you can see on the inferior surface. The superior surface has nothing on it. It's subcutaneous and nothing attached to it. The scapula is a flat bone. It's thin in the middle. See, it's almost transparent in the middle. It's a triangular in shape. It has three angles: the superior angle, the inferior angle, and the lateral angle. This is the right scapula, by the way. This is the ventral surface or the anterior surface, and this is the posterior surface. On the posterior surface, you can see the spine of the scapula. The lateral angle of the scapula is the glenoid cavity with superior and inferior glenoid tubercles, or supraglenoid and infraglenoid tubercles. And projecting anteriorly is the coracoid process, and the end of the spine that curves anteriorly is the acromion process. Okay? Between the spine and the glenoid cavity, there's a notch called the spinoglenoid notch, and you can see it better on from the lateral side. As you can see here, this is the spinoglenoid notch. This is the lateral side of the scapula. Now, the borders of the scapula, there is a medial border, lateral border, which is called the axillary border. This is the medial border, this is the vertebral border, and the superior border, and you can see the suprascapular notch on the superior border of the scapula for the suprascapular nerve and the suprascapular ligament that bridges the notch. Okay, the proximal humerus has a head. The head projects medially, and the neck always comes after the head. This is the anatomical neck because there is another neck here, which is the surgical neck. This is the anatomical neck. Between the head and the tuberosities, the greater tuberosity and lesser tuberosity of the humerus, you can see the bicipital groove. This is the bicipital groove or intertubercular groove, and the surgical neck between the tubercles and the shaft of the humerus. It's called surgical neck because it's common to be fractured here. The humerus is most fractures of the humerus are in the surgical neck. Lower down in the middle of the humerus, on the lateral side, there is a V-shaped tuberosity for the attachment of the deltoid muscle called the deltoid tuberosity. It's not seen here. The joints of the shoulder joint, the sternoclavicular joint, this is the sternoclavicular joint. between the medial end of the clavicle and notch on the manubrium sterni, just just lateral to the jugular notch in the middle. This is the notch or the surface for the sternoclavicular joint. It's of the synovial plane type. It has a capsule attached around the articular margins, and there is an intra-articular disc, as you can see here, that divides the joint cavity into two cavities. This is the intra-articular disc. It's fibrocartilage to bear the weight of the upper limb, all the upper limb on this point, on this area. The ligaments for this joint, we have anterior and posterior sternoclavicular ligaments. We have interclavicular ligament. This is the interclavicular ligament that attaches the ends of the clavicles together and the superior border of the manubrium sterni. And the costoclavicular ligament on the lateral side, it's lateral to the joint. You can see it here, and has made markings on the inferior surface of the clavicle, attaches to the clavicle to the first costal cartilage and rib. You can see it here, okay? It's a tough ligament that holds the clavicle. Okay, the acromioclavicular joint between the acromion and the clavicle. This is the acromioclavicular joint. It's between the medial surface of the acromion and the acromial end of the clavicle, the flat end of the clavicle. Synovial of the plane type and capsule attached around the articular margins. The ligaments of the acromioclavicular joint is the acromioclavicular ligament. You can see it here. This is superior acromioclavicular ligament. And below that, and between the clavicle and the coracoid process, is the coracoclavicular ligament. The coracoclavicular ligament has two parts. Anterior part called the trapezoid ligament, and posterior part called the conoid ligament. So the conoid ligament and the trapezoid ligament are parts of the coracoclavicular ligament, the ligament of the acromioclavicular joint. Why does it belong to this joint? Because it fixes the bone that makes the joint, which is the clavicle. Okay? Great. The glenohumeral joint, or the shoulder joint, it's an articulation between the head of the humerus and the glenoid cavity, and the head of the humerus is not proportional to the glenoid cavity. It's much larger than the glenoid cavity to allow for the wide range of movement of the shoulder, but on the expense of stability. That's why it's common to get dislocation of the shoulder. Okay? And that's why we have a rim or a collar of fibrocartilage that deepens the surface a little bit. This is the labrum glenoidal, or the glenoid labrum. This one, the glenoid labrum. Because as you can see here, it's a shallow surface for articulation. It's a multi-axial joint with wide range of movements. The tendon of the long head of biceps is attached to the supraglenoid tubercle, so it is inside the shoulder joint, but outside the synovial cavity, because the synovial membrane, loops around the tendon of the long head of biceps. Okay, the synovial membrane attaches to the margins of the articular surfaces, and below it's redundant, because when we abduct the arm, the head goes down, so it must provide a space, redundancy for the descent of the head in abduction. That's why it's redundant inferiorly, and communicates anteriorly through an aperture in the capsule with the bursa of the subscapularis muscle. It forms a tube, as I mentioned before. around the tendon of the long head of the biceps. This is a specimen, real specimen for the shoulder joint, opened. Of course, you can see the head of the humerus, the capsule, with the thickenings in the capsule representing the ligaments of the joint. And also you can see the labrum glenoidal here. This is the glenoid labrum, the fibrocartilage that deepens the shoulder joint. The bursa of the shoulder include the subscapularis muscle, the subacromial, between coracoid and the capsule, and between the acromion and skin. All these are bursa. Also bursae with other muscles, tendons around, other tendons around the shoulder joint. And as mentioned before, the synovial cavity, synovial membrane may communicate with the subscapularis bursa. The capsule is thickened anterosuperiorly to form the superior, middle, and inferior glenohumeral ligaments. Some books describe it as 2 anterior and 1 posterior glenohumeral ligaments. Superiorly and somewhat posteriorly, this is the coracohumeral ligament, on the superior aspect. And between the greater and lesser tuberosities of the femur is a ligament called the transverse humeral ligament. So these are the ligaments. Also, one of the ligaments is the coracoacromial ligament. You see that? The coracoacromial ligament, it's not a direct ligament for the shoulder joint, but it's very tough and prevents the upward displacement of the humerus, like falling on the elbow, for example. The upward thrust of the humerus is prevented by this ligament. It's a very tough ligament. If the fall was hard enough, the humerus breaks, and not this ligament. It's a very tough ligament, the coracoacromial ligament. Now, tendons of supraspinatus, infraspinatus, and subscapularis and teres minor blend with the joint capsule. That's why they are called the rotator cuff muscles. The rotator cuff muscles, the importance of the rotator cuff muscles, by blending with the capsule, they hold the head of the humerus in place. They hold it in place. They are crucial for the stability of the shoulder joint. The blood supply of the shoulder joint is through an anastomosis, the scapular anastomosis, as you can see here, through branches of anterior and posterior circumflex humeral. This is the posterior circumflex humeral artery. This is the anterior circumflex humeral artery. Also the suprascapular artery, the circumflex scapular artery. Okay, all these share in the supply of the shoulder joint. The nerve supply of the shoulder joint from branches of the posterior cord of the brachial plexus, the suprascapular nerve, the axillary nerve, and the lateral pectoral nerve. One last thing to say about the fascia that's related to the shoulder. Actually, it's medial to the scapula, between the two scapulae. In infants, the fascia between the two scapulae, the adipose tissue, is of the brown variety, means it's rich in sympathetic supply to provide warmth for the infant. Okay, this is what we have to learn about the osteology of the shoulder region. I hope you got the maximum benefit from this lecture, and thank you very much for watching.